A coronavirus is a kind of common virus that causes an infection in your nose, sinuses, or upper throat. They're called coronaviruses because under a microscope, they look like a crown. Most coronaviruses aren't dangerous, but in early 2020, after a December 2019 outbreak in China, the World Health Organization identified a new type of coronavirus. Officials named this new virus Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. This is the virus that causes COVID-19. What is coronavirus disease 2019 COVID-19? Coronavirus disease 2019, or COVID-19, is a disease that can cause what doctors call a respiratory tract infection. It can affect your upper respiratory tract, sinuses, nose and throat, or lower respiratory tract, windpipe and lungs. The COVID-19 outbreak quickly spread around the world. It spreads the same way other coronaviruses do, mainly through person-to-person contact. Infections range from mild to serious. COVID-19 is one of 7 types of coronavirus, including the ones that cause severe diseases like Middle East Respiratory Syndrome, MERS, and Sudden Acute Respiratory Syndrome, SARS. The other coronaviruses cause most of the colds that affect us during the year but aren't a serious threat for otherwise healthy people. Is there more than one strain of SARS-CoV-2? It's normal for a virus to change, or mutate, as it infects people. A Chinese study of 103 COVID-19 cases suggests the virus that causes it has done just that. They found 2 strains, which they named L and S. The S type is older, but the L type was more common in early stages of the outbreak. They think one may cause more cases of the disease than the other, but they're still working on what it all means. What are the symptoms of COVID-19? Early symptoms include fever, dry cough, fatigue. The virus can lead to pneumonia, respiratory failure, septic shock, and death. If you notice these severe symptoms in yourself or a loved one, get medical attention right away. Trouble breathing or shortness of breath, ongoing chest pain or pressure, new confusion, can't wake up, bluish lips or face if you're exposed and infected. Symptoms can show up in as few as 2 days or as many as 14. It varies from person to person. Coronaviruses can affect different species of animals, in addition to people. MERS and SARS were both linked to animals. Studies show COVID-10 has ties to snakes, bats, and pangolins. Many people who got the disease early on were linked to a large live seafood and animal market in China. You might hear it called a wet market. The first cases may have come from animals sold in the market, then spread from person to person. OST of the time, it spreads when a sick person coughs or sneezes. They can spray droplets as far as 6 feet away. If you breathe them in or swallow them, the virus can get into your body. Some people who have the virus don't have symptoms, but they can still spread the virus. You can also get the virus from touching a surface or object the virus is on, then touching your mouth, nose, or possibly your eyes. Most viruses can live for several hours on a surface that they land on. A study shows that the COVID-19 coronavirus can last for several hours on various types of surfaces: copper, 4 hours, cardboard up to 24 hours, plastic or stainless steel, 2 to 3 days. That's why it's important to disinfect surfaces to get rid of the virus. Doctors and health officials use this term when they don't know the source of the infection. With COVID-19, it usually refers to someone who gets the virus even though they haven't been out of the country or haven't been exposed to someone who's traveled abroad or who has COVID-19. In February 2020, the CDC confirmed a COVID-19 infection in California in a person who had not traveled to an affected area or been exposed to someone with the disease. This marked the first instance of community spread in the US. It's likely that person was exposed to someone who was infected but didn't know it. In addition to practicing the prevention tips listed above, you can meet as a household or larger family to talk about who needs what. If you have people at a higher risk, ask their doctor what to do. Talk to your neighbors about emergency planning. Join your neighborhood chat group or website to stay in touch. Find community aid organizations that can help with healthcare, food delivery, and other supplies. Make an emergency contact list. Include family, friends, neighbors, carpool drivers, doctors, teachers, employers, and the local health department. Choose a room or rooms where you can keep someone who's sick or who's been exposed separate from the rest of you. Talk to your child's school about keeping up with assignments. Set yourself up to work from home if your office is closed. Reach out to friends or family if you live alone. Make plans for them to check on you by phone or email.